It's a pleasure to have you here. We're streaming live on DSTV channel 421, GoTV channel 144, and around the world at myjoyonline.com. We start off with some rather disturbing news as the head of Africa's Centers for Disease Control and Prevention, CDC, says the continent's case fatality rate has risen alarmingly to 2.5% higher than the global level of 2.2%. In a Reuters report, John Nkegasong told reporters that earlier in the pandemic, Africa's rate had been below the global average, adding the current rate is beginning to be very worrying and concerning. He, however, did not give reasons for the increase. He added the number of African nations with a rate of deaths per case is higher than the global average is growing. There are 21 countries on the continent with the rate above 3%, including Egypt, the Democratic Republic of Congo, and Sudan. Now, despite Mr. Nkegasong's concern, the World Health Organization's Africa head, Matshidiso Moeti, told an online news conference that Africa's case fatality rate was not dramatically worse than other regions. She said higher rates were probably due to the challenges African countries most severely affected by the second wave, notably South Africa, where a more infectious variant has been detected, were facing in providing care for infected people. According to Africa CDC data, over the past week, cases around the continent decreased by nearly 7% compared to the previous week, while deaths increased by 10%. And this information is courtesy the Reuters news agency. But, well, from South Africa, we've been joined by Dr. Basitana Fora, who is going to share the South African situation with us, as you just heard in that earlier report. Thank you for joining us, ma'am. Good morning to you. Oh, I understand she's a journalist, actually, not a doctor. Apologies, ma'am. But tell us what the experience in South Africa is like with regards to COVID.
Well, COVID-19 certainly ravaged the whole world, and more especially South Africa, not only the African continent, but especially South Africa. Right now...
Hi, I can hear you, Fora. Hello?
Apologies for that.
Hello?
Apologies for that. As I was saying, that South Africa is currently going through mourning. We have lost our first minister to the COVID-19 pandemic, and you know the situation in the country is very volatile in this particular time. We are at the marking of more than 1 million positive cases since the beginning of the COVID-19 reaching the South African country.
We are told that the new variant is more contagious, and in fact, flights from your country to other European countries have been banned. Tell us how health centers are dealing with the surge in cases.
The amount of cases that are being reported basis are really scary. Level 3 lockdown. So what that means is that there's very minimum activity that is happening in terms of industries exporting of goods in the country.
We seem to have a challenge with the line there. Hi, Fora. Well, we seem to have a challenge with your line. We'll try reaching you because I'm interested in the South Africa case, because it is an example being cited for the surge in deaths or case fatality rates in Africa. I'll come back to you, Fora, while we try and work on that line. But that was Fora. She was joining us from South Africa. And as you just heard, they've just lost a minister to COVID, and they currently have 1 million cases. Well, we've also been joined by Professor Alfred Yosing. He's head of community health at the University of Ghana Medical School. Thank you so much for your time here this morning. Well, we received news. We have 658 new cases. Let's start off this way, looking at the impact on the surge in the numbers on our already burdened health facilities.
Yes, thank you very much. As we continue to say, it is very worrying and alarming. And at this rate, certainly our health system will not be able to cope. And the once the cases are in the community and we expect that this new variant, as being more contagious and being more infectious, can spread from one person to other more rapidly. And we are beginning to see it is causing more severe disease in also relatively younger persons without any underlying comorbid conditions. And that's where the difficulty lies. And we need to take drastic measures. I think we need to go back to some of the important measures we put in place, limiting the number of social gatherings and the persons involved in these gatherings, and also the duration of these gatherings as well. It is important that if we are not going to wait until such a time that there is no alternative but to lockdown, then we need to take some drastic measures within the shortest possible time as we are in.
Is it not already time to lock down? My colleagues have visited the Ga East Hospital, for example, which was at the beginning of the pandemic designated for treatment of the disease, and it's full. I've had people tell me about how even doctors are struggling to get beds for their facilities. At what point should we decide to go on a lockdown, if not now?
Yes. Technically, you say there is no cutoff point, as we say, but we always need to balance the effect that a lockdown has on the general economy, and especially on vulnerable households, persons who need to go out there every day to go and work before they are able to get their livelihood, and also the impact on the national economy. So I think as the people, we still have opportunity once we comply with the mask wearing, social distancing, and the hand hygiene. Because the lockdown per se is not an all-in-all solution. Countries have locked down, gone back to lockdown again. Once we have the opportunity now, it behooves on us as individuals, as corporate persons, and as institutions to ensure that we are able to do the basic things that we need to do, and also go back to effective contact tracing, getting people into treatment. Even if they are at home, we ensure that they do not spread the disease. We still have opportunity to do that, and then curtail the rising numbers.
Prof,
Yeah.
let's talk about managing our cases. From your point as a community health expert, especially when we know that contact tracing is not being done as it used to be, are we handling this the right way at all? Or we are just leaving it a chance that by some interesting, miraculous way, COVID-19 will just leave us?
I think generally to say, we typically we might have relaxed or let down our guards a bit in all spheres of the front of fighting COVID. For example, in case management, we are still struggling to get the core cadre of staff who will be able to run our ICUs, intensive care units in the treatment centers and the new infectious disease centers that we have set up. These are things that we probably should have done much earlier. But probably because the cases reduced and were few in numbers, at a point we didn't have any inpatients, and probably that's where we slowed down a bit. If we had gone on with all the preparations and measures and put teams on standby, things like that, we will be in a better position to fight. Be that as it may, we still need to increase the effort, get as many personnel as possible to this side, and provide them what it takes. Whatever it is we promise them should be provided so that they are motivated or incentivized to, as they are sacrificing, and then they do it to support Mother Ghana. So I think there is more we need to get from our leadership and from the ministry and from Ghana Health Service and all interested parties, also from the public and the private sector as well. Private health facilities who are involved, private laboratories who are involved, that we all do our bit to support the national effort. But I think we really need to have a serious look and put emergency measures in place.
I appreciate your time this morning. Professor Alfred Yorsing is Head of Community Health at the University of Ghana Medical School. And really disturbing pictures showing on our screens there. You can clearly see people struggling to cope. For those of you who think this is a hoax or a cooked up story, I hope that these pictures convince you enough to wear a mask and to stay safe. Well, thankfully, we've been able to get Basitana Fora back. She joins us from South Africa to share the South African story. Thank you for joining us once again, Basitana. You were telling us about how health facilities in South Africa are coping with a huge number of infected persons.
Absolutely. Thank you once again. Yes, we were speaking on those challenges that South Africa is currently facing in terms of the high number of cases that are being reported on a daily basis. And, you know, one thing that is also being spoken of in South Africa right now is the vaccine. South Africans are anticipating the vaccine, and as per, expected, there are some who are saying that they are not looking forward to the vaccine. However, we have been listening to a lot of institutions who have been giving background as well as expertise as to why it is important for the country to receive a vaccine. And the South African government have announced that the first batch will arrive in the second quarter of the year, which means it will arrive in June. And the first people who are going to be prioritized are the essential workers as well as the prisoners, because as you may know, prisoners are confined in one space and there's a number of them. Speaking of prisoners, one thing that has been happening in South Africa, especially when the first hard lockdown took place, is that criminals who were behind bars for petty crimes were, released from prison in order to relieve the number of cases that come from that side. But unfortunately, even such drastic measures that governments take, it's still not making a difference, considering the fact that so many cases are being reported and so many deaths are also being reported. And in South Africa, one trend that takes place, more especially when it comes to COVID deaths, is that people take it seriously once it is a celebrity, once it is someone who is, in the limelight, someone in the media industry has passed. That is only when people realize really the effect and the extent of COVID-19 situation. As I've mentioned before, that we are currently mourning the first minister to pass on due to COVID complications. His name is Minister Jeff Khatebe. He was the minister in the presidency, so he was very close working with the president of South Africa, Cyril Ramaphosa. So this is also, a very big wake-up call for the country.
But I mean, I'm quite embarrassed to say this, but we are struggling with compliance and adherence to safety protocols. So, for example, in his latest address or his last address, the president directed our Inspector General of Police to ensure that his men were arresting people or enforcing the wearing of face masks or face coverings in Ghana. Do you have a similar situation in South Africa? Are people complying with the social distancing, the wearing of face masks and all?
Yes, absolutely. So South Africa is currently in level 3 lockdown.
Okay.
And part of the regulations is that one has to wear face mask, whether in public, whether at your normal business place where you work, everyone has to wear masks. And unfortunately, in South Africa, compliance is not really at a high rate. A lot of people walking around without masks. I tell you now, I am at a local hospital, at Pulusong Hospital, and I'm seeing people who are not wearing their masks properly. And that goes to show just how people are not taking the matter seriously. We were also told that police will have to enforce mask laws. Police have to enforce that there's social distancing in some places. But unfortunately, police themselves feel that they are at risk. I'll make a good example with myself being a journalist here in the country. A lot of police have been reaching out and explaining how they feel they are at risk for COVID-19 because they are expected to take care of so many people and to take care of people who are not abiding to the law. However, they feel that they do not have the resources to do so. For instance, they have to arrest people for not wearing masks. They have to handle that person. So they feel that they are not also given the enough resources to enforce the laws that are put in place. Generally speaking, in South Africa, the laws and regulations that have been put in place for the level 3 lockdown are not listened to. For instance, right now there is a ban on alcohol sale, but there are people who are still drunk. How? We don't know. So it all goes to show that mask laws are not the only laws that are ignored, and that is why the cases in the country are going to go up and up and up.
I appreciate your time, Batitana Fora, a South African journalist. Please stay safe, and hopefully we will be speaking to you and get some good news even as South Africa battles the surge in coronavirus cases. She was just sharing the South Africa story with us. As you just heard, they lost a minister to the coronavirus pandemic. As you may be aware also, the variant discovered in South Africa, we are told by scientists, appears to be more aggressive, spreads faster, and quite lately we are being told could possibly cause more damage to the body than the earlier strains. Well, let's come back home. Construction of an infectious disease treatment center at the Kolebu Teaching Hospital has stalled after workers abandoned the site. JoyNews' visit to the premises reveals key electrical work is yet to conclude. A foreman told my colleague Daniel Dazi the plastering and other finishing works have been held up. For that reason, the facility was scheduled to be completed 30 days after work commenced nearly 10 months ago. This has left the 8-bed treatment facility at the nation's premier referral center overburdened as Ghana's COVID-19 case count rises. Daniel Dazi reports.
Soon after Ghana recorded its first few cases of COVID-19, it was announced that a 50-bed infectious diseases facility was being constructed here at the Kolebu Teaching Hospital. Close to a year after construction began, this facility is yet to be completed. This is contrary to announcements by authorities then that it would take 30 days for this facility to be finished, so it would help in the fight against COVID-19 in the country. As the number of positive cases in Ghana begin to hit 200 per day, the attention of the public has been drawn back to this facility, which is far from complete. So where I'm standing currently is the doorway for the main entrance to the facility. Some of the plastering has been done. You can see there's space there for some of the electronic fittings in there. But you walk inside and you realize that a lot of the plastering has not been done. Now, we've been speaking to some of the workers who are here. They tell us that the crew of workers who were supposed to wire the facility came to work on the 24th, went on break, came back on the 1st of January, went on break, came back on the 7th of January, and that's the last time they reported. It's expected that they will come back to work sometime this week, and after that, after they are done with the wiring, then the plastering for the inside can be completed. There's also the roofing, which has not been completed in the inside. As you can see, the ceilings have not been fitted in. Again, we are being told that the workers who are in charge of this part of the work will do their work by this week so that the construction can continue. The empty spaces also for the doors indicate that there's still some work to be done there. We are being told that the doors are being constructed off-site, and they are waiting for those contractors to also bring in the doors so that they can fit them in. So that was the main entrance, the main arrival hall or the reception. These look like bathrooms to an untrained eye. You see the plumbing fittings in there. There are a number as well here, a number of cubicles in here. You can see this space looks like, a space for sinks. And in there, looks like space for WCs in there, about 4 of them. So, all in all, this is a facility that when operational should be able to really serve the general public. You can see there, unfortunately, some of these iron rods are rusting. It's been a while since they were planted there, as you can see. So we are looking through to really be able to report to you the extent of work that has been done here at the infectious diseases facility, which is part of the Kolebu Teaching Hospital complex. This is a 50-bed facility which has been on the books for close to a year at least when the construction officially began. When we visited here in March, the field was being cleared for the construction itself to begin, and it was expected that it should be finished in some 30 days or in the shortest possible time. Remember, more than 50,000 positive cases of COVID-19 have been recorded in the country since then, and this is a key weapon in the arsenal of government in the fight against this disease. We are speaking to some of the supervisors for the gang of workers here. They are confident that within a month all of this work can be done, but then again they are unsure that the requisite funds will be released in time, and also that the workers will return to site so that this facility can quickly come be operational and help in the fight against COVID. As you can see, it's much larger than the current facility, which is seen to COVID-19 patients, which is full. It's an 8-bed facility directly opposite this one, and currently doctors there tell us that it is completely full, and they are currently treating the average of about 20 patients every single day. Most worrying about it is that 2/3 of the number of patients they treat there, according to our sources, are medical personnel, that is doctors and nurses, who are working on the front line in the fight against COVID-19 in the country. Hospital authorities did not speak to us, but we have sources who are telling us that as soon as the doors are done and the wiring is done, this is work that can be completed in the shortest possible time. The question remains about the funding that must be released from the Ministry of Health, which would, of course, be the agency acting on behalf of government to ensure that this work is done in the shortest possible time. They were unable to tell us why the work has delayed from March 2020 till now, where so many lives could have been saved, so many persons could have been treated if this facility was complete. For Joy News, this is Daniel Daze at the Kolebu Teaching Hospital.
And right here in our studios, I'm Bernice Abubeidulansa, and this is Joy News Desk. Our President Akufo-Addo on Thursday submitted to Parliament for approval a list of persons he's nominated to serve as ministers in his new government. Included in that list of 46 persons are many of those who served in his first government. A few others, such as former Deputy Education Minister Dr. Yaw Adutwum and former Deputy Attorney General Godfred Dame, have been elevated to serve as substantive ministers. The number of ministries has also been slashed, while some others have been scrapped. Let me run you through the list. Quite a lengthy one, but well, national security and finance, you have those who served in the former government still being designated. Albert Kandapar for national security, Kenneth Foriata for finance, trade, same. Alan Tramanting, defense, same. Dominic Nituwul, interior. Ambrose Derry, foreign affairs, Shadia Yokopoche, and all these were ministers. Attorney General and Minister for Justice, Godfred Dame. Okay, so we also have communication and digitalization, Honorable Eslawusu Ekufo, and energy, Dr. Matthew Proku-Prempeh, education, Dr. Yaw Adutwum. We have, just quickly running through, just speaking and choosing, gender, children and social protection, Adjoa Safo, chieftains and religious affairs, Ebenezer Kojokum, and employment and labor relations, Ignatius Bafwe, war information, Kojo Opong Nkrumah. The list goes on and on, including regional ministers. We are told that there will be no deputy regional ministers in this administration. Well, let's get a reaction on this from Professor Kwabena Fukantanka, who is a senior research fellow with Odikro, and he joins us via phone. Good morning, Prof, and thank you for joining us. Your initial
Good morning, and thank you for having me.
Pleasure. Your initial reactions to this list released by President Akufo-Addo.
Yeah, thank you very much. Honestly, I'm not surprised about the numbers.
Okay.
In terms of the number of ministries and the projected number of ministers the president is likely to appoint. In the sense that if you look at the numbers in Parliament, for example, the president has very little option. Because if you increase the number of ministers, it means a lot of them will also come from Parliament because of the constitutional provision that the majority of the appointees, ministers will come from Parliament. So the president has very little option to consider. And therefore, at this point in time, you would expect the president to consider the best of the best, if you like. High quality, trustworthy appointee. Because if you are looking at what happened in the elections and all that, this is a testing moment for the president to be able to, if you like, go through the ministers, the previous appointees, one after the other, and identify those he thinks can do the work for him. So for me, I'm not surprised about the numbers. This is the time the president appears to be trying to bring some kind of ingenuity into the appointment. You know that over the years, people have complained about number of ministers. There was a time the current opposition leader said that Ghana could even run with only about 60 ministers. This is a time for us to try something like that. And so naturally, not having so much option in terms of our appointees, the president has to look at the ministers who will help him execute his job. For example, if you go to Parliament, and you know that the list that has come, the majority of them are from Parliament.
Yes.
So you go to Parliament, you're looking at parliamentarians who can serve as ministers. Most of the time, first-time MPs have very little option, little opportunity to be appointed as ministers. So you're looking at the old MPs who are there. Which of them can execute the job properly? So I'm not surprised that the president has done that and chosen the old MPs, those who have been there over the years and have the experience. Because at this time, experience matters a lot.
All right, Prof.
And so if you look at the list, you realize that the majority of them from Parliament. But I'm surprised a little bit about two appointments. The Western Regional Minister.
Okay.
And then Greater Accra.
Why are you surprised?
Yeah, I'm surprised because, you know, research has shown that most of the time appointees, ministers who are regional ministers find it very difficult to attend parliamentary proceedings. And so considering that you have the numbers are that close, and therefore you need the majority of your MPs all the time in Parliament, I'm a little surprised that two MPs have been appointed as regional ministers. Any other positions, I wouldn't be surprised. But for regional ministerial positions, you know, in 2016, Odiko did a research report, and the then minister of the Western Regional Minister, I think, was it Edu or something like that, or somebody like that, had absented himself from Parliament more than about 100 times. Okay. So if you appoint an MP as a regional minister, they have duties to perform at the regional level. So most of the time they will go to the regional level and they will find it very difficult to attend parliamentary proceedings. Yeah. So I was expecting that the president wouldn't appoint any MP as a regional minister. But of course, he knows best and he knows what he's looking for, and therefore he's made the appointed. But I was not expecting something like that.
Prof, let's talk about the persons who did not make it this time round. Talk about Mr. Samuel Atachia, Gloria Kufu, Joe Latte, who the president, Joe Garte, I beg your pardon, who the president had commended on a number of occasions for his work in the railway sector. Did those also come as surprises to you, or you're quite indifferent about
as I said earlier, I'm not that surprised, because whether you like it or not, not all of them were going to find their way back into ministerial positions.
Some have suggested that for Gloria Kufu and Atachia, the accusation or bashing of having a family and friends government could have played a role in their exclusion in his government this time. Do you agree?
Hello?
Hello, Prof?
Yeah, hello.
Yes.
I didn't hear you clearly.
I'm saying that for Samuel Atachia and Gloria Kufu, for example, some have said that the accusation that the president was running a family and friends government could have led in the decision to lay them aside. Do you agree with that line of thinking?
Well, I may not necessarily agree with them, but that's also a valid point, of course. Several ways to kill a cat, you know. So if there's an option for you to choose, then you are choosing your best. There are several considerations come on board. And so if that is one of the considerations, I'm not surprised. I will not be surprised. I won't argue with them. They will be right. They may be right. Okay. At the end of the day, the most important thing is that the president had an option to reduce the number of ministers. Naturally, looking at every president will reduce the number of ministers. And some of them will, by all means, will not get appointed the second time. So you are looking at various options, and those you trust so much. Because over here, trust is very important. So you consider those you trust, those who are hardworking, and of course, you can't say that all those who were not appointed the second time were not hardworking or that. But there are several considerations.
Okay.
So for me, at the end of the day, it is the president's prerogative to choose who he works with. But at the same time, I do believe that the president, over the last few weeks, has had several meetings with people and he has talked through what he's doing, the number of ministers he is likely to appoint. Some of us have suggested between 70 and 80. And so if that is the projection, let's say 70 ministers, then you are considering several factors that would determine the best out of the lot. And I think that let's give the president the benefit of the doubt and say that, well, all those he has appointed were the best in terms of his appointees who worked with him the previous administration. So for me, going forward, we are yet to see how things are going to pan out, considering that this is the first time, perhaps, that we are going to have few ministers or fewer ministers appointed by a president. And that was also a testing moment for us to see that perhaps for all these years, we had the opportunity we could have done with very few ministers. All right.
But okay. Prof, just to bring in the caveat, we are yet to receive the list for deputies for this. So this list would actually be larger, or would have more people on the list than we have now. But quickly, in wrapping up this conversation, during the 2020 campaign period, the current government was very heavy on policies for the Zongo communities, and in fact, one of the ministries that was created during the first administration was that of the inner cities and Zongo development. We don't see that this time round. Is it surprising? Could there be an impact on this for the NPP government?
Well, I'm not surprised, and I think the president has done the right thing. Of course, it can be an agency. There can be an agency in a ministry. For example, Ministry of Local Government, and you know the name has even been changed. There are other additions. Now, it can be an agency under a ministry, an agency that looks at the Zongos or Zongo development, inner city. So for me, that is an option that the president can explore. It doesn't necessarily have to be a ministry. You know, the president experimented with a number of ministries. Planning,
monitoring and evaluation.
Evaluation and monitoring and evaluation and all that. These were new ministries the president created. So let me say that, for want of a better expression, the president experimented with all those ministries. And now it's on us that, yes, we can do without those ministries. Of course, we can create agencies and the various ministries to cater for all those things. So for me, you don't necessarily need a ministry to cater for the inner cities and Zongo development. An agency can easily do that. So I'm not surprised about the president scrapping that ministry and other ministries. So for me, this tells us that if institutions can work properly, then we can do with very few ministers, because the ministerial position is just an oversight role. It's a policy position. So if directors of bodies and institutions can help the ministers work, I think we can do with very few ministers. And having gone through the highest number of ministers over the last 4 years, about 120, 20-something ministers, we've seen how that works. And now we are going to have the opportunity of using very few ministers. We are going to also try this and see how that also works. So that will inform future precedents in terms of appointments and all that, in terms of ministries and ministers. So for me, looking at agencies to cater for other areas and all that will be the best option, at least for the moment.
I appreciate your time this morning. Professor Safikan Tanka is a senior research fellow with Odikro, and he's been sharing his thoughts on the list of ministers designate as presented by the presidency. Senior Staff Association of Universities of Ghana has announced a nationwide strike over outstanding Tier 2 pension arrears of its retired members. The association is also pointing to the failure by the Fair Wages and Salaries Commission to engage them on conditions of service, and also the delay in the award of market premium for their action. They vowed to remain at home until their concerns are addressed. Manuel Kranting was at the University of Ghana, where the members are defying orders from their national leadership to join their colleagues in the Senior Staff Association to strike. He reports.
Dated 13 January 2021, served on the Executive Secretary of the National Labour Commission, declaring our intention to embark on an industrial action. I wish on behalf of the National Executive Council to announce the withdrawal of services by all members of the Senior Staff Association, Universities of Ghana, with immediate effect. Now, this has become necessary in view of the following unresolved concerns. 1, non-payment of our Tier 2 pension arrears. 2, delay.
Chants by members of the Senior Staff Association of Universities of Ghana as they declared an indefinite strike across the country on Thursday, January 21, 2021. This comes 8 days after the group served notice of its intended industrial action over the failure of government, the employer, to address concerns over their conditions of service. Zakaria Mohammed is the national chairman of the association.
Further to our letter dated 13 January 2021, served on the Executive Secretary of the National Labour Commission, declaring our intention to embark on an industrial action. I wish on behalf of the National Executive Council to announce the withdrawal of services by all members of the Senior Staff Association, Universities of Ghana, with immediate effect. Now, this has become necessary in view of the following unresolved concerns. 1, non-payment of our Tier 2 pension arrears. 2, delay in the award of market premium and non-basic allowance. 3, failure by Fair Wages and Salary Commission to engage us on our conditions of service. Ladies and gentlemen, for your immediate information and for further probably avoidance of doubt, members are required to lay down their tools until further notice.
This means all middle-level staff of public universities across the country, including accountants, administration staff, storekeepers, and other non-teaching senior members of the university, are absent from their posts indefinitely. On the first day of the strike, scores of students at the University of Ghana were stranded at the Student Accounts Office as they waited to be attended to. In fact, it's double jeopardy at the University of Ghana as local members of the Teachers and Educational Workers Union, TEU, are defying orders of the national leadership to suspend their strike. Students are having to take up extra roles of TEU members to keep the university running. Eko is a final-year engineering student who has for the past week been manning the Porter's Lodge at the Sabah Hall.
There have been others before me, and then I'm joining in. I help with the registration, the freshers. When they come, I help them register their names after they've done the manual registration. And then I collect the keys of persons who are submitting them, and then I give the keys of the others who have already submitted. This is actually my final year, and though my classes are virtual, I'll need to be concentrating. I would still have to have my eyes on my phone as long as the lectures are online and then they are actually active. I have to focus on everything that they are teaching me, and then every time that I try to do that, there's someone here coming to collect a key, submitting a key, and that means I would have to move away from my phone and go attend to the person. And actually this takes a portion of what I'm supposed to study from me.
But the effect of these industrial actions go beyond just handing out and collecting keys. Michael Ashali is a student journalist with campus-based Radio Universe.
Because of the modular system, some people, select few students, have the opportunity to go to have physical classes. So particularly for one that happened this week, a Russian class, the level 100s were supposed to have an interaction between themselves and some of their teaching assistants, but they were locked out of the place because some of the people who are supposed to man the place had the keys and they didn't want to come around because they are on strike. And these are TEU members. To talk about sanitation on campus generally, a majority of the work when it comes to sanitation is being done by TEU members. Go to some of the lecture halls, the bins are full to the brim, and even on the floor, some of the rubbish on the floor. So it's been quite a difficult thing. I must say that go to washrooms within some of these places, also looking very unkempt.
We've got an update on this story for you during the midday news.
Morning, welcome to Business. My name is Darryl Kwao. The National Development Planning Commission and the Ministry of Finance, in partnership with the United Nations Development Programme, have launched a COVID-19 recovery plan for 5 metropolitan, municipal and district assemblies to bounce back. The implementation of the plan is expected to speed up the COVID-19 recovery process and accelerate progress towards the SDGs attainment. Here's Martina Bugi's report.
The beneficiary assemblies include the Kumasi Metropolitan Assembly, Sanaribu Municipal Assembly, K2 South Municipal Assembly, Sefiariansu Municipal Assembly, and the Kasina Nankana West District Assembly. Addressing participants at the launch in Tamale, Director General of the National Development Planning Commission, Dr. Kojo Esiam Mensah Abrampa, said if the nation would succeed hitting all the SDGs in the next 10 years, then there is the need to support the local economy.
We also know that if you're going to succeed in hitting all the targets for the SDGs in the next 10 years, then we need to look at how we can support the local economies of our respective districts and local governments. And if there's any time to do that, it is now. It is now that people are searching for alternatives. It is now that people are searching for new knowledge. It is now that people are taking risk in order to bring back their economic laurels and individual income, improve their individual incomes. And therefore, for National Development Planning Commission, much as we undertake our advisory responsibilities and advise the President and Parliament, we will also honor our key responsibility of supporting the sectors and local governments in the best use of building their economies. We're doing that in a close partnership with the Ministry of Finance, Ministry of Local Government, and also UNDP in particular, and the other development partners.
Madam Angela Lusig said the bottom approach to delivering the integrated national financing framework will target citizens directly at the local level.
In other news this morning, Vice Chancellor of the University of Ghana, Professor Ebenezer Oduro-Wusu, has commended the University of Ghana Business School for the provision of a modern information center lounge for undergraduate students. According to him, the ICT lounge will equip students with ready job market skills. There's more in this report. The Rock City Hotel, in collaboration with the University of Ghana Business School, has commissioned a refurbished modern ICT lounge to ease the burden of students. According to the Dean of the University of Ghana Business School, Professor Justice Baole, the facility will help students acquire digital skills in an era of COVID-19 where teaching and learning have been moved online.
Well, so as here in the business school, we strive to give our students the best of training, and so we currently have a number of initiatives that are ongoing. But you would agree with me that there is no initiative in education now which will not include giving students the best of experience when it comes to the digital space. And so what we have sought to do is to create an ambience that allow our students to not only acquire digital skills, but also to do it in the best of environments. That when COVID came, we had to move our teaching online. There are a significant number of students who do not even have a smartphone, let alone a laptop. And for such category of students, it was difficult for them to be part of the virtual teaching and learning. And so this facility has come at the right time because this provides space to such category of students.
Also at the commissioning, Vice Chancellor of the University of Ghana, Professor Ebenezer Oduro-Wusu, said the ICT lounge will equip students with ready job market skills.
Because whenever they were brought into the lab to do simulations on the stock exchange, stock market, they were found wanting. And so when I got back, I spoke to the dean and I asked him to try as much as possible to ensure that our students get that level of exposure. I'm happy we are seeing this today. This is not what I want to see, actually. But this is the beginning of what I want to see. And he knows. Yes, sir.